With osteoarthritis and a pre-existing tear of the shoulder tendons, the humeral head tends to migrate upwards. A standard anatomical replacement is not possible. A reverse replacement is necessary that can offset the lack of tendons. The same approach is used. The humeral head is cut. Then the bone is prepared with rasps to allow the placement of the socket-shaped humeral component. The humeral glenoid is then exposed. The bone is prepared using different cutters. This preparation then enables the placement of a cementless component fixed with 4 screws into which the glenoid hemisphere can be inserted. The 2 implants are put back into place. The deltoid muscle in the shoulder can once again assume its lifting role thanks to the shape of the implant. The shoulder is no longer painful, and full range of motion is generally restored. Post-operative recovery is the same, with immobilization in a vest for 3 weeks.